Hi, my name is Sue Kagel. I'm a certified healing touch practitioner and instructor. I'm also an RN with a Bachelor of Science degree in nursing. I have been doing energy work, healing touch in particular, for over 20 years. The purpose of healing touch is to bring the energy field into balance. So we're looking at the energy centers in the body. There are 7 major ones. And we're looking at helping them to open up, come into balance, clear, and energize them. We're also looking at the energy field that surrounds the body to come into a place of balance and clearing. There are places that can be congested. There are a variety of things that we learn how to sense with our hands and then assess in the body. So we're working to bring it into balance, bring the energy field down into a nice, even eggshell shape around the body, which brings it into a much more grounded place. So that being said, as we bring the energy field more into balance and we bring the chakras into a place of being open, they almost act like little turbine engines that are bringing the energy in and out of the body. Healing touch benefits are that you don't have to disrobe. It's done just either sitting in a chair or lying gently on a table. The practitioner gently places hands on the body after doing an interview intake. Hi, I'm Sue Kagel. How are you?
Hi, I'm Michael.
I'm a certified healing touch practitioner, and I'm here to help you with whatever issues you may have that we can use energy therapy to address it. So I'm going to ask you some questions first so I can get a good idea for what your needs are.
Okay.
And I'm going to look at you body, mind, spirit, and emotion because that gives us a holistic approach for how to address what your issues are. And an energy assessment to look at what are the energy centers or chakras doing in the body, what's the energy field showing us through a hand scan assessment, and what's the edge of the field looking like? Is it a nice eggshell shape around the body connected at the feet, or is it disrupted in some kind of form in that process? So what I'm going to do is have you lie down on the table, and then I'm going to assess your energy field, looking at your energy centers, called chakras, and your energy field so I can get a good sense of what's going on. I'm going to use a pendulum, which is my version of a stethoscope.
Okay.
And then based on that and what you've told me, then we'll choose specific techniques that are going to work best for what your issues are.
That sounds great.
So I'm going to start by just taking, I can use anything with a weight on it. This happens to be a nice little rock on a chain. You can use a necklace, you can use a paper clip on a piece of dental floss. So what I'm doing is looking to see what are the energy centers doing. And a clockwise circle, like this started out but changed, shows me an open chakra, and anything else shows me that it's compromised. So what you're presenting is that all of your energy centers or chakras are blocked. And that's nothing to be concerned about because with the kinds of things that you've told me are issues, that would be normal. I'm just going to put this down here. Then I'm going to take my hands and do what we call a hand scan and just run my hands down. I've learned to be very heightened in my sensitivity so that I can feel areas of perhaps tingling or vibration or heat or areas that might feel prickly or something like that. So through your whole body there's a sense of a kind of prickly feeling, like if one took a balloon and rubbed it in your hair. And I'm going to check where the edges of your energy field are. They should be eggshell shaped around your body. So it's pretty heightened up here over your head, perhaps related to your brain fog. And then it comes down through your chest and it drops off right about at your waist. And then I don't feel it very much. So when a person has a presentation like this, it's frequently that they don't have a lot of energy. Part of what we want to do is get you grounded and back down in your body. So we do the intake. We do the assessment of the energy field, and then from that we make a very individualized session specifically for that person from a variety of techniques that we might use. I'm going to gently place my hands on your body, working my way up, and I'll spend a little more time on your joints and on your head because of the brain fog to see if we can't get everything settled down for you. You don't have to do anything. Close your eyes, relax, take some deep breaths, and just let go. So where I'm going first is, this is the seat of emotions, creativity, sexuality, and the organs underneath. And then I'm going to come down at your knees and just aim towards your root chakra that comes off your pelvic floor. It's called the root chakra. It's your grounding chakra. The color is red, and it goes to the physical body, physical energy, direction and purpose in life, and the organs underneath. And again, to get more grounded, this is an important chakra. This is like a grounding cord that goes all the way down to the center of the earth. I'm going to bring my hand up to the chakra that's just in the area of the ribs. This is the seat of the mind. So we have physical, emotional, mental. This area at the mind is also relationships, self-esteem, and your personal power. Then we come up to the heart chakra. We're starting to get in now to the areas of the spiritual chakras, as we call them. And I'm going to do the heart and the throat. The throat chakra is your area of communication. And then from the throat, I'm going to go to the brow chakra. The brow chakra has to do with clarity, intuition, sinuses, headaches, the eyes. So from the brow, I'm also going to hold the crown at the top of the head. This chakra connects you to the divine in whatever way you see that to be. And I can feel under my hand on your forehead the energy moving around. It feels like it's waving back and forth. My hand is kind of moving with the energy. I'm not moving my hand, as this chakra that needs to spin clockwise is trying to open. And then from here we hold the crown chakra and out to the transpersonal point, which connects you to the universal energy that's all around us. I'm going to take my hands and gently move through your energy field, pulling up and out to clear any other debris that may be in the field and to help reset your energy pattern now into a new healthy pattern. I can also do a very smoothing, calming motion. There's also a technique called magnetic clearing that goes from the top of the head all the way down to the feet that helps clear out a lot of the extra sensations that one gets from the various treatments that you might be experiencing. Leaving the medication in place, it's just energetically clearing out that excess in the field. Following that, we reassess the energy field and see if it made a difference. And then we have a little chat to see, how do you feel now? What was that like? How are you doing? So I'm going to reassess now and see how we did. Starting down at your feet, we now have clockwise circles. If I feel your energy field again, the edges of it are nice and even. That area above your head has come down. There's a softness as I hit the edge. I can feel it with my hand. And I look at the edges of your field, they're nice and centered. So, take your time. I'm going to do one other little technique here. And go around the whole edge of your field. And how do you feel now compared to when we started?
I feel a lot more relaxed. I feel some of my pain has dissipated.
Any questions for me?
I don't think so.
Great. Pleasure working with you.
Thank you.
You're welcome. Sometimes one session is enough. Sometimes people do repeated sessions for various things. What we find in cancer supportive care is that it's best to do a session once a week during the course of treatment in order to keep the energy field flowing, decrease the side effects of the medication, and increase quality of life. There was a research study done at Stanford through the Women's Health Center where they have something called Healing Partners. And Healing Partners offers free healing touch sessions for anyone in any course of their cancer stages. So during the course of that, they did research with it, and they found quality of life greatly improved. They found that the fatigue levels were much better, energy was much higher, Pain levels decreased. Healing from surgeries was much faster. Pain levels less. The brain fog was better. It did very well. So there is research on healing touch. It's done on many different facets of it. This isn't just used in cancer supportive care, but in any aspect, as I mentioned before. Thanks so much for your time and interest. I hope that this has been educational for you and that you're willing to try healing touch in the course of your illness or treatment, or even as a caregiver, because it's really nurturing and nourishing and supporting in any of those aspects. There are wonderful practitioners available to help you. Thanks for your time.